session of our scientific forum, We Talk to You. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, Puberty to Menopause. The session featured leading experts across the country who shared their valuable insights on key health topics, aimed to raise awareness and promote overall well-being at the society at large. Today, we are delighted to have Dr. Amit Kumar Barpha with us to share his expert perspective on importance of vaccination in preventing hepatitis A and B. I shall be sharing more about our today's speaker in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. HBI was founded in 1990. HBI is a is a founded in 1998 with the government of India requested to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue NTB. Our first manufacturing facility was set up in Uti. This facility is one of its kind in India, rolled out the country's first vero cell culture rabies vaccine in the year 2000. Today, we are leader in ARV segment with a presence in around 60 countries. HBI has launched several other vaccines and become a major player in human vaccine segment. HBI has been a key supplier of the pentavalent vaccine to the Government of India under its universal immunization program. In yet another milestone, HBI has introduced Havisure in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults. With the vision of shaping global healthcare by spearheading the One Health initiative and the mission to innovate, produce, and market quality healthcare products and service to improve and extend lives. We are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging for our flagship brand Abhara. As a part of CSR initiatives, we have adopted schools where IL provides infrastructure support and basic facilities, including assistance with the midday meal program in association with NEDB through the gift milk program. Hundreds of school-going children benefit from our daily milk nutrition. We have also donated an oxygen donation plant to in Telangana Institute of Medical Science and Research Center, that is in Gachibowli, Hyderabad. There are just a few. These are the just few highlights of IIL. For more information, please visit our website www.indimmune.com. Puberty to Menopause is one of our unique initiatives where we address a wide range of topics related to women health and well-being. Welcome to today's episode of We Talk to You. The session is dedicated to highly significant, often overlooked topic: importance of vaccination in preventing hepatitis A and B. To understand better, to help us understand better this condition and its impact, we are joined today by Dr. Amit Kumar Barpha. Sir is an MBBS, MD, General Medicine, DM hepatologist. Sir is a very well-known hepatologist with experience of more than 15 years, currently working as a consultant hepatologist in Vishesh Jupiter Hospital, Indore. Hello, sir. Hello. Thank you so much for joining us today. Sir, am I audible? Hello. Sir, am I audible?
My pleasure. My pleasure to be on this podium.
Thank you so much, sir. So today's topic is a very interesting topic that is importance of vaccination in preventing hepatitis A and B.
Yes, yes,
So
I can hear
we
you,
have
and
few
it's my
questions.
pleasure to be on this podium and to have a discussion on hepatitis A and B vaccination.
Thank you, sir. So today's session, we have some commonly asked questions. So our first question is, what is hepatitis and different types of hepatitis?
I think there is.
Yes. So, can you hear me, sir? Our
Hello, can
first
you hear me,
question is,
ma'am?
what is hepatitis and different types of hepatitis? Yes, sir. Yes.
Continue.
Yes, sir.
Can you hear me,
So,
ma'am?
yes, sir. You're audible?
Okay, so I'll just give you a brief regarding hepatitis A and B vaccination, a slight introduction, and then we'll take on with discussion from there. So,
Yes,
as we
sir.
all know, first we'll have a brief discussion regarding hepatitis B, and then we will go towards hepatitis A.
Yes, sir.
Hepatitis B, as we all know, actually is pandemic throughout the world, and the global prevalence differs in different parts of the world. It was more prevalent actually in Western Africa and in China and South Asian countries.
Okay.
And in regard to prevalence, India comes in the intermediate group, and we are very fortunate that we have a vaccine for hepatitis B, because of which gradually we are seeing the downtrend in the incidence and prevalence for hepatitis B. Hepatitis B is a virus which basically spreads through basically blood-borne route and through sexual route. Hepatitis B can lead to not only acute diseases in the liver, it can also lead to chronic diseases in the liver, which in turn can lead to liver cirrhosis and also liver cancers.
Okay.
The most common mode of spread for hepatitis B throughout the world used to be the vertical transmission. And with the inception of vaccination for hepatitis B, this vertical mode of transmission now can be very well prevented. And the
Okay.
first country to start universal vaccination program for hepatitis B was Taiwan, and because of which serially in couple of decades the prevalence for hepatitis B has reduced very much there. And we
Okay.
are glad to share that India also has universal vaccination program for hepatitis B, which was started somewhere around 2012 or 13, and because of which at least we are now able to prevent vertical transmission for hepatitis B, and
Yes.
because of which global burden, especially in country like India and in Africa, we are seeing the prevalence for the hepatitis B is gradually coming down.
Okay.
And indications for hepatitis B, as government has adopted, like universally everybody whosoever is born should be given Hep B vaccination. Anybody with any chronic illness, whether it be liver cirrhosis, diabetes, CKD, should be universally vaccinated for hepatitis B. Healthcare workers, and for that matter, I think everybody should be given vaccine for hepatitis B,
Yes.
because vaccine for hepatitis B is highly effective. We have to give three doses, 0, 1, and 6, and it is easily available. In between, there was a shortage of the same, but now it is easily available, and it is pretty cheap too.
Okay.
This was some thoughts regarding hepatitis B. Now I will be sharing few like my thoughts for hepatitis A vaccine.
Sure, sir.
Hepatitis A actually differs from hepatitis B because the mode of spread for hepatitis A is fecal-oral. Hepatitis
Okay.
B spreads through sexual and blood route. Hepatitis A spreads through fecal-oral route. Hepatitis A is not known to cause chronic diseases. It is an acute self-limiting infection. And hepatitis A, although we call it as acute self-limiting infection, but in some of the patients, it can too be lethal.
Okay.
Hepatitis A can also cause in few subset of patients acute liver failure, in which it is a life-threatening disease, and because of complication, we can also lose the patient.
Okay.
Uh, Previously, there was a thought that hepatitis A is universally pandemic or present to everybody in our country. So, vaccination for hepatitis A was something which was questionable. But
Okay.
nowadays, what we are seeing actually is as the quality of life and the hygiene status is improving in our country, so we will have sporadic cases of hepatitis A as well. So it will
Okay.
comes in leaps and bounds. And usually, if hepatitis A occurs to somebody who is into the later half of adolescence and adulthood, they can have severe disease and the chances of acute liver failure increases.
Okay.
So, hepatitis A vaccine should also be given to almost all the patients if possible, if they can afford. Recommendations regarding hepatitis A vaccine is specifically to travelers and sometimes and should be universally given to people who are suffering from chronic liver disease and other chronic elements. So these are my thoughts for hepatitis A and B vaccine. So I think we can proceed to any questionnaires if there are any from here.
Yes, sir.
Yes, sir.
Certainly.
Certainly.
Thank you for
Thank you
giving
for
a
giving a
detailed
detailed.
introduction for hepatitis B and hepatitis A and the history of hepatitis B also. It's like very nice to know that where it originated and all. So there are common questions, like every like usually they get common people think like how is hepatitis B and A gets transmitted? Can you please enlighten on it?
So hepatitis B, as I told, like the transmission route is through bloodborne and through sexual route. And for hepatitis A, the transmission route is fecal-oral. Fecal-oral means it is getting transmitted through contaminated food and water.
Food and water. So, what are the symptoms, sir? Symptoms of hepatitis A and hepatitis B?
So hepatitis A will cause acute illness. So patients usually will give a history of febrile illness to begin with. Then they will have myalgia, a bit of sore throat sometimes, and then patient will complain of nausea, vomiting, and decrease in appetite. And eventually they will start becoming ectric and develop jaundice. So
Okay.
symptomatology will be like will mimic with any acute viral illness, and then it will be followed by icterus or jaundice. For hepatitis B, if it is acute, it also follows the similar pattern. But in case if it is chronic, then it can lead to like complications related to liver cirrhosis and portal hypertension, which sometimes will present with liver decompensation, development of ascites and all.
Okay. Thank you, sir. Sir, is hepatitis A and B prevented?
Yes, hepatitis B can be prevented through vaccination, and same goes with hepatitis A as well.
Okay.
Yeah, so vaccine definitely can help in the prevention of both hepatitis A and B.
Very rightly said, sir. The vaccination is very preventive. So, what is the schedules for this vaccine, sir, for hepatitis A and B?
As for hepatitis B, usually we have to give 3 doses, and they should be segregated in a way that the first and second should be 1 month apart, and the second and the third one should be at least about 5 months apart. So 016 is the schedule for hepatitis B vaccine. For hepatitis A vaccine, you have to give 2 doses and they should be separated by about 5 to 6 months.
So, sir, thank you for saying the schedule. As you mentioned, that hepatitis is mostly fecal-oral. So nowadays we all eat out. So we are prone to get a hepatitis A.
Yes, recommendation says that people who are travelers, who are traveling outside too much, or people actually who are going to like another countries and especially Western population coming to India or endemic countries, so they should be definitely vaccinated. And as I told, like what is happening nowadays that if hepatitis A happens to have, if somebody gets hepatitis A during the age in the childhood days, then the disease is less severe. But as what we are seeing nowadays is like because quality of life is improving, so instead of childhood, people are getting hepatitis A in their adulthood. And
Okay.
if we get hepatitis A in the adulthood, the usually the severity of disease increases and chances of patient landing into acute liver failure increases. So
Okay.
definitely people who are actually traveling too much and taking outside food, then obviously should be getting vaccinated for hepatitis A as well.
Okay, sir. Thank you, sir. So, usually, if people, common people think that vaccination is only for the pediatrician. Like, what is the importance of adult vaccination, sir, in your view?
No, definitely there are many diseases which affect in the adulthood, and gradually hepatitis A is among one of them. And there are many other diseases actually which can create problems in adulthood. So this is a myth that we have to give vaccination only in pediatric age group. Then depending upon the disease and depending upon any chronic element what patient is having, adult vaccination is equally important. Nowadays, actually, what we do is patients who are having any chronic illness, like I see many patients with liver cirrhosis. So patients with liver cirrhosis definitely should be vaccinated not only for hepatitis A and B, it should also be given vaccination for influenza, pneumococcal, sometimes like Shingrix, and also definitely there is a role for adult vaccination as well.
Thank you, sir. Thank you for saying the importance of adult vaccine, and everyone should take adult, the dosages of adult vaccine. So my next question is do how effective and safe are the vaccines, like hepatitis A and B vaccine?
Hepatitis B definitely very effective vaccine and safety wise. So like we can say that till now I think billions of doses of hepatitis B vaccine might have given throughout the world. So it is
Yes.
very much safe with hardly any side effects. And I think the same goes with hepatitis A vaccine as well. So a bit of prodrome and a bit of fever can be sometimes post vaccination patient can have. But otherwise in long run there is not much complications associated with both the vaccines.
Yes, sir.
They
Thank you,
are
sir.
safe.
Thank you, sir. Thank you for saying this, sir. Sir, apart from the vaccine, what are the hygiene practices that the common people should follow?
Yes, so as I told, hepatitis A virus, the mode of transmission is contaminated food and water. So the most important thing what we should follow is the water should be pretty much clean, neat, and hygienic. In case we are using filters at home, we have to make sure that the filter of our filter is working well and we are replacing on proper time. In case we don't have facility for RO or filters, then what we can do is we can boil the water at home and then drink it, especially in rainy seasons because this is the time that we see more transmission of all these diseases. Regarding food, I think what we should do is it should be neatly prepared, hygienically prepared at home, and morning food should be taken in the morning, and we should again prepare in the night and take the food in the night. And avoid taking food from outside. In case there is any emergency and we have to take outside food, what we should avoid is raw things. Usually, what we see is like many a times when we go outside, people are behind this salad and fruits. Like we'll always
Yes.
try to take more fruits and salad and we'll say that this is the healthy source. Although this is a healthy source, but usually transmission of fecal-oral diseases happens when we take raw food. So in case we
Yes.
are going outside and taking any food outside, try avoiding this fruit and salads and the raw part of the food. The food which is pretty much cooked, usually the bacteria and viruses will be dead and the transmission will not happen. So these are the basic precautions what we have to take.
Thank you, sir. Thank you. We have a question from the audience. Doctor, can hepatitis infection cause jaundice, and will vaccines help to prevent this?
See, we have to understand that jaundice is a symptom. Just like fever, jaundice is also a symptom. Whenever there is insult to the liver, whatever may be the cause, it may be because of viruses, it may be because of alcohol, it may be because of any other drug causing insult to the liver, patient will develop jaundice. So the cause of jaundice, if you go, then virus is one cause. So definitely the cause of jaundice, in case if it is virus, it can be preventable with vaccine. That too, viruses can be many, like hepatitis B and A are among few viruses which can cause jaundice. So definitely B and A virus, if we take vaccine, we can prevent jaundice too, which is to be caused by these viruses.
Okay, sir. Thank you. We have one more question, sir. Like, if one person, a family member, get a hepatitis A infection, so
Mhm.
that the even all the family members can get a same infection.
Usually, no. See, suppose if somebody has hepatitis A disease, we may not need to segregate him. Okay, so what we have to do is just we have to make sure that the food and water is clean, and we are maintaining good hygiene in the toilet, and we are not basically using the same clothes as weared by him. Otherwise, there is no absolute segregation of that patient is not required. It does not spread by touching the patient. Basically, it spreads by contaminated food and water.
Thank you, sir. Thank you for your answer. So today's take-home message for all our audience regarding hepatitis A, B, and in the world of social media, everyone Google it, all the signs and symptoms. Please give your take-home message to the audience,
See,
sir.
my take home message to everybody should be like people who are traveling too much, people who are taking outside food, living in hostels, definitely get yourself vaccinated with hepatitis A, because hepatitis A, although thought to be a benign disease, can too be sometimes life threatening. We have seen many patients dying because of acute liver failure, which was caused by hepatitis A. So we should not take hepatitis A also lightly. And people who are traveling, living in hostels, taking outside food pretty much frequently, they should get vaccinated for hepatitis A. For hepatitis B, it is now very wide known fact that universal vaccination for hepatitis B is recommended by Government of India as well. So definitely we should opt for both the vaccines, and because they are the sources which we can very well prevent by an effective vaccination. Yes.
Thank you so much, sir. Thank you for being joined us today and giving so much information regarding hepatitis A and B.
Thank you. Thank you.
So, so I'm going to conclude the program. We hope, like today's session on it was informative and valuable in spreading awareness on importance of vaccination in preventing hepatitis A and B. A special thanks to Dr. Amit Kumar Barpha for sharing his time, expertise, and insights with us today. For those who would like to revisit the program, and the video will be available in all our official social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word, as many, including friends, family, and relatives. Until we meet again next in our live talk, stay healthy, stay aware, and please take good care of yourself. Thank you. Thank you so much, sir.
Thank you. Thank you. Thank you.